Okay. I am your host, Bev Cotton. I'm a volunteer with AARP New Hampshire, and co-hosting with me this morning is Karen Ulmer-Dorsch, also an AARP volunteer. Please note that we're recording, as you just heard me say, and so this will be available on the website at some point in time within the next day or two. Before we get started, I'd like to cover a few little housekeeping items. We have muted everybody, and some of you we've been speaking to. So if you could mute yourself again prior to the speaker beginning, we'd appreciate that. But we would love to hear from you. So if you'd like to ask a question, please use the chat box, which can be accessed by clicking the chat button for most of you at the bottom of your screen on a toolbar. You type in your message and just hit enter, and we should be able to see you. Our fellow volunteer, Mary Roberge, will be monitoring the chat and raising your questions throughout the program. At AARP, we've been promoting the health and well-being of older Americans for over 60 years. In the face of the coronavirus pandemic, AARP is providing information, advocacy, and resources to help older people and those caring for them protect themselves from the virus, prevent it from spreading to others, and cope with the health problems and financial disruptions caused by the virus. Joining our conversation this morning is Todd Fahey. Todd is the State Director with AARP New Hampshire. Welcome, Todd, and thank you so much for joining us this morning. Let's just jump right in with the first question here. Could you tell us what exactly AARP New Hampshire's role is regarding the COVID vaccine rollout?
Sure. Well, good morning, and thanks for those kind words of introduction. Hi, everybody. It's nice to see our intrepid volunteers. They are many and varied, and they're on the line making this all happen. Without them, we couldn't do it. To Team New Hampshire, a few of which are on the line, so thank you. And also to our many guests, so thanks for joining. And we also have some of our special guests. We are a nationwide organization, and I will answer your question, Bev. We are a nationwide organization. We are just like, call it out for what it is. I won't be boring. We're a nationwide organization, and a national organization with a nationwide footprint. And so we have a state office in every state, and we have several of our colleagues from Rhode Island on today. So greetings, Rhode Island. Just listening to us from the Rhode Island state office. That's pretty exciting. So, and they just joined on their own accord. So good to hear you. So what are we doing? So here's what we're not. Let me first say what we are not. We are not direct care providers. We are not healthcare providers. We really are. We are advocates, and we are providers of information. And so what we're doing really is we're advocating sometimes, sometimes quite publicly, sometimes not so publicly. But always advocating, and we're always giving information and by way of information and education. So what does that look like? Well, the advocacy piece is we are, like, for instance, when COVID started hitting, we were talking about the nursing homes. And what are we doing to make sure that people in those facilities, and most of you know in New Hampshire, most of the deaths are happening in long-term care facilities. That is not a knock on our long-term care facilities. If any people on this call have folks there or work in those facilities, they do fine work. We have among the best in the nation, but people are still dying at very high rates. So one of the issues we would be doing is to make sure that we're working to prioritize people who are vulnerable, and certainly the most vulnerable and susceptible to the virus are people in long-term care facilities. And for sure, I mean, and so we're talking with lawmakers about that, and we have been for quite some time. As far as the vaccine rollout, well, specifically on the advocacy front, we have asked by letter I wrote to both the governor and his team and the Commissioner of Health and Human Services on January 14th, asking for two things, essentially prioritizing older Americans who are most vulnerable, and for full transparency. So you knew, for most of you, you knew initially that they've changed there was the group 1A, which were people in long-term, in hospitals and such, and long-term care facilities. And then a few weeks ago, we started out, I guess just last Monday, with the vaccinations of 1B. And those numbers changed to comport with what the CDC was recommending for prioritization of those categories. So we wrote a letter on January 14th, even before that, asking for prioritization and for transparency about what was happening. I think we've seen some prioritization, which is great. And I know we'll be talking about that a little later in the program. But I do think that we need a little more transparency. I'd like to know how many people are getting vaccinated. I was just given a study, a report from I think Forbes magazine that said only 62% of workers nationwide in long-term care facilities have opted, 62% wouldn't take the vaccine. It's a big number. I mean, these are the workers, the direct care workers in those facilities. Yeah. So we need to sort of maybe look into that. So long story short, what we're doing now is just following up with where we are. So with decision makers and our state officials, just literally a half an hour ago, I wrote an email, another follow-up email to the Commissioner of Health and Human Services saying, thanks for the work for the rollout. Still looking for the transparency we asked for in January 14th. So like, how many people have been vaccinated in these facilities? What does that look like? I also asked, for instance, I'm sure many of you have seen this. We're a few weeks into this, and I'm not an epidemiologist, nor is AARP an epidemiologist, but my gosh, you still see a lot of people in these facilities who are passing and succumbing to the virus. So why is that? Was that a trailing sickness? Are these people who were ill before they got the shot? Are they not getting the second? Is there an intervening issue that's happening? I just think we all need to sort of know that. So that's really where we are. And then on the education piece really is educating people about and just giving people good information. So we want to be a reliable source for information so people know where to go to get information. We refer them to the physicians, we refer them to the CDC, and we're referring them to the state websites. And I'm sure we'll get into those in particular. But generally speaking, that's what we're doing. And we're really trying to get good information out. And my last point on that, and I'll pause, is that we just fielded a survey. And of course, we're champions of the 50 plus, and we just fielded a survey of almost 800 people in New Hampshire over 45. And one of the questions we focused on is what their perceptions were about the vaccine. Would you take it? Do you think it's safe? And we have really good data. So we're going to share that data with decision makers to help, do a great public service and make sure our members are protected.
Thank you very much, Todd. I wonder if you could speak to another topic. There's a lot of misinformation out there about the vaccine floating around. For someone who is on the fence about getting the vaccine, where can they find the best information so they could make a good decision?
Yeah, and I would ask one of my colleagues to even put it in the chat. I mean, we have a great, we really have been referring to people to the CDC website since the outset of our engagement on this. Basically, cdc.gov/coronavirus, and that's where you should be going for good information. Go straight to the source. The CDC is the place to go. The state also has some websites, but I guess that would be the first place for people to go to get good information. And then secondarily, if they have more specific questions, feel free to ask your healthcare provider. I mean, that's also another good place to go. We're referring people to their physicians and healthcare providers.
I put the link in the chat for you to be able to access that CDC information. And Jeannie also put it in the chat. So it will be right there for you. And you can copy and paste chat links into a Word document if you want to, or you can save the chat. So there are a couple options there for you. Another question, Todd. First, let me ask the participants if they have any questions thus far for anything that's been presented so far. And if you do, please enter them into the chat box. I don't see any right now, but we will continue to watch for those. Todd, I understand that there are a few different ways to register to get the vaccine. Can you speak to that?
Sure. So I was really happy that our team in New Hampshire did a teletown hall we actually, just to let you know, and we are blowing our horn. I mean, we're proud of the work we do, and we got to blow it a little bit. I mean, so we worked with the state of New Hampshire right out of the get-go to get a teletown hall out. It's a way for us to dial out to our thousands of members. We have about 220,000 members in New Hampshire. Now, many don't answer the phone. And it's a little funny, turn of events, because we tell them, because a lot of people who are calling are phone scammers, right? So even when we call, they don't answer because they're very trained. But we did a teletown hall with thousands of people, but we had planned that in late December with the governor, with Dr. Benjamin Chan, and with Commissioner Lori Shibanet. And many of you may have been on that call. And we talked a little bit about fortuitously, it was right on the eve of the rollout. I think we did it on Thursday, and I guess it was like 2 weeks ago, this coming Friday, that the registration opened. And essentially, it boils down to two ways to sign up. One is online, and the other one is, if you can't get online, you go to 211, which is a way to sign up. If you want to go the online, and I'm sure one of my colleagues can put it into the chat, it's www.vaccines.nh.gov. www.vaccines.nh.gov. And then for those of you who don't have computer access or have some struggles, you can call 211. The preferred method for sure was the vaccines.newhampshire.gov, but by all indications, I think it's going quite well. We had a torrent of questions and complaints before it launched, and it is slowed substantially. So that tells me that our people are getting what they need by way of information. And you're seeing some of the news accounts too, that when people as recently as today, I mean, people actually moved, the state and those scheduling moved appointments around to accommodate the snow, which was pretty neat, right? And I've heard that now they're going to be starting to make phone calls to people who have not yet registered, which is a great idea. So that's it. So vaccines.nh.gov, which is the preferred method, and then also just call 211, which will link you into people. It's a staffed facility with hundreds of people fielding those calls to help you get registered.
So Todd, good to see you. As always. So after someone calls 211 or registers via the website, they're all set, right?
Well, I guess each person will still have to schedule their vaccination, right? So there's a little distinction for others. I mean, language matters. So let's be really clear. Vaccines are fine, but vaccines that don't find their way into a human being by way of vaccination doesn't do much of anything, right? So we hear about vaccines going to waste. So you can get scheduled for a vaccination, but until you are vaccinated, you're not vaccinated. Certainly, and basically taking the 2 courses that's required. So basically, you will get once you sign up, you will get an email back, and you'll have to schedule through the VAMS system. That's another thing we should talk about. The VAMS is something that comes from the CDC. So that's not a fraudulent email. You want to be aware that when you get that follow-up, sometimes a day or 2 or 3 later, it's not fraudulent. That's how it's supposed to look. People who call 211 will receive a phone call to schedule an additional follow-up to schedule that appointment. So again, if you go online, expect a reply online. And if you go in person by 211, expect a reply in person by 211.
Okay. So does AARP New Hampshire have a website with resources on the vaccine?
We do, aarp.org/NH vaccine. And that's again, we are the purveyors of, I guess we're the recyclers of accurate information. We want to be sure that our members we are going to be an echo chamber. We have used those phrases for the state of New Hampshire. Frankly, another plug for us and all of our volunteers, just as we did around the election, right? I mean, people wanted to know how to vote, and we gave them information. And so if some of you may recall, we sent a statewide mailer out about what the absentee process looks like, absentee voting process. And we're going to do the same thing here with a vaccine postcard. So you'll be hearing from us shortly, just giving people a ready one-stop place to go. So our website is basically containing the data of the state website and none other. I mean, maybe the CDC too, but only reliable information.
Okay, thank you, Todd.
Oh,
Let's
you're
pause
welcome.
again. Let's pause again for any Q&A.
So we do have a few questions in the chat. One of them is, it's a married couple, and the husband, his wife registered them for the vaccination. He signed up and he did get a date, February 20th. And they were under the impression that both he and his wife would be included. His wife has received an email every day saying she's not picked a date, and they called the 211 line twice and they say they not to worry. And they wanted to know if you had any thoughts.
Yeah, that's a question that came up a lot. I've heard it on teletown halls, and what I understood is that people together in that type of arrangement can register each other to sign up. I guess I would still follow up and understand what that means when they say not to worry. You have to worry, right? I mean, there's only so much vaccine. There are a lot of people waiting. I think it would be maybe important to maybe call back 211 and say, look, do I need to go online? I mean, can you help me register so we're clear? So I really have a confirmation of registration. But I will tell you, if that caller wants to send an email to me or call me directly, we can actually get that information directly over to the state operations website, state operations center, and we have a great contact there who can give even better information. So you can email me at tfahey, T-F-A-H-E-Y @aarp.org. It's just my first initial and my last name all under lowercase, or just give me a ring at 603-230-4109, and we can try to get more information from you, for you.
Thank you. We have another question regarding the appointments. This caller wants to know if you can look at other appointment dates after you have signed up.
I don't know the answer to that question. And so again, in the spirit of giving good information and not good information, I won't answer. But again, 603-230-4109. Call me, and I will work with our comms directors in close contact with the Emergency Operations Center, and we are getting good information literally in real time when we reach out to people over there. I will say the state has done nothing is without flaw, for sure, right? We live in an imperfect world, but they're working hard to make this happen, and some of these channels have been exceptional, and we continue to feed information like this to those channels to help inform when they do an FAQ on their website or something. We're trying to share information upward also with the state to make sure that we're giving good information. So questions like yours that others probably have are seen and addressed.
Great, thank you, Todd. And one other question, and it's not really related to the vaccination itself. It's basically this caller wants to know how folks are handling services such as mail, delivery packages, and anything that's brought into the home. This person is saying their delivery drivers don't wear masks, and one wonders what to do about that.
Yeah, well, I guess again, I don't want to step into the realm of public health because I'm not a public health expert. Here's what I would say. I think you should follow all state and local guidance. There is a statewide mask mandate, of course, that's in public places. So whether that applies to a person pulling into your driveway with the driver not wearing a mask is probably up for debate, and the answer is probably it's not required. I say probably, and I'm a lawyer, so that means 51%. That's all. So there's a 49% chance I'm wrong. Having said that, to the caller with that question, or to the participant with that question, it's an awkward thing. I I've had the same thing happen. They get out of their delivery truck, they come marching over, friendly enough, right? But they want to get the package off the truck and go about their business, and they don't have a mask on. And then they walk right up to me. I mean, so that's happened at least twice to me. So I think it's fair to, maybe leave a sign or something to let them, ask them to not open the door or knock on the door. Or one time I had somebody knock on the door, again, unmasked at the beginning of the pandemic. And I opened a window next to my front door, said, can I help you? Which was kind of strange. And like, well, I'm here for something. I'm like, well, can you wear a mask? But to that point, I guess I would still look at the CDC guidance and do what you need to do to make sure that you're following CDC guidance. And ultimately, obviously, if the person's not paying attention, I'm not sure there's much you can do about that, except for you to take precautions for yourself.
Great, thank you.
Great question. Yeah.
And there are no more
So
questions.
is that it, Mary?
Yes.
Okay. Todd, do you have any closing comments before we close?
Well, I do. I guess I would just say, here's my closing comment. I think it's an ask really of people. I think part of this and part of the idea of what we're doing as an organization is to make sure that good information is getting out. So very much appreciative for people who've taken the time to try to gain good information. And I'm sorry if I didn't have it, but I just hope you understand that I'm not going to give you inaccurate information, and I'd rather defer. And I say defer, it's not deny. I'm not going to not give it to you. I'll do my best to get it, and as will our team. But I would ask you to really make sure that you speak to people within your circles and zones of influence to share what you learned on this call, relative to maybe the work that we're doing for people who may be not aware of what AARP is doing, but really most importantly, and I stress this, most importantly, to make sure that they are getting the best information. I will tell you that there is a difference in willingness to accept and to take this vaccine. There's some pretty clear demarcations by age and by some socioeconomic numbers. And I think we need to get to a herd immunity. I mean, you're hearing it again, and forgive me, I'm not in any way giving a public health commentary. It's not my realm, but you are hearing that even from the health experts on the news that it's important that we have a degree of herd immunity so that these multiple variants don't continue to be a problem for us. So I think that we really want to support the state's efforts and the CDC efforts on a widespread, broad vaccination of the population. And you have a role in that, both individually and through those people you touch, because they will listen to your voice and give them good information. So that's my final ask. And so use our information to share. It is good information, and we all, and I know we will get through this. My wife and I were just talking. We love the holidays. I'm really looking forward to what December looks like in 2021, because 2020 wasn't great. I'm sure we're all in the same boat.
Thank you, Todd. Yes, Mary?
Yes, Todd, I'm going to type your email address in the chat, but if you could just also mention it again.
Sure thing. It's T Fahey, all lowercase, at AARP.org. TFAHEY at AARP.org. And the same thing is true. If you have people who are annoyed, or they have hard questions, or they have something that they want to say or to convey, I mean, I can take it. Let them send it. I'd rather that they speak and not hold their peace.
Thank you, Todd, for sharing your time and your expertise with us all today. I certainly found it helpful. And thanks to our audience for joining us today for the Coffee and Conversation. I hope you enjoyed hearing from Todd and that the information and the resources will be valuable to you. And be sure to check on AARP New Hampshire's website, aarp.org/nh, often for more online programs coming soon, including a program about romance scams, a webinar on the 6 pillars of brain health, live cooking demonstrations, yoga, and yes, more coffee and conversations. Be well and take care.
Thanks, everybody. Thanks, Karen, Bev, and Mary. Great conversation.
Thank you.
Thank
Thank you.
Thank you. And thank